the patient has some disorders of the tongue, maybe a tumor of the tongue. So here they are going to do a procedure on the excision of tongue called as glossectomy. So when I say a glossectomy, it is a partial or the complete removal of tongue. In cases like cancer of tongue, they might have to do a radical resection. If the surgeon is going to remove exact half of the tongue, it is called as hemiglossectomy. So we need to know whether the glossectomy is less than half or is it equal to half, which is a glossectomy, or it is a complete resection of the tongue with a neck dissection. Here whenever we say as a neck dissection, it does not mean that they are going to cut off the neck. Here they mean that the physician is going to dissect the lymph nodes of the region of the neck, which are the cervical group of lymph nodes. Okay, so the procedure code is without neck dissection and with neck dissection. Other would be a radical procedure with a suprahyoid resection, the lymph nodes that are present above the suprahyoid muscle. Next comes a procedure called as a palate. Now we saw the hard and the soft palate, which is a procedure being done called as a palatoplasty. So there is one common procedure called as UPPP, which is Uvulopalatopharyngoplasty.